I'm pleased to be here with Dr. Tarina Kang, who serves as the Chief Medical Officer for our USC Verdugo Hills Hospital, overseeing the medical operations that affect both the Keck Medicine of USC faculty as well as our community physicians. Prior to her role at USC Verdugo Hills Hospital, she served as the Medical Director for Quality at Keck Medical Center, our academic medical center, and the Medical Director for the Evaluation and Treatment Clinic at Keck Medical Center. Welcome, Dr. Kang.
Thank you for having me.
Of course. So prior to becoming the Chief Medical Officer at USC Verdugo Hills Hospital, you worked in emergency medicine and transformed the Evaluation and Treatment Center at Keck Medical Center. Can you speak a little bit about that?
So Keck Medical Center is unique in that there's no emergency department, and so the Evaluation and Treatment Clinic, or the ETC as we like to call it, was created to provide patients access to their physicians. I think that the collaboration has been really positive for a couple of reasons. Emergency medicine physicians are trained to be able to take care of a whole gamut of patients. So we're comfortable taking care of medically based patients and post-surgical patients alike. Another positive aspect of this partnership is that we are comfortable taking care of potentially critically ill patients. And so if that unfortunate event arises in the ETC, we are able to render aid.
I think the results that you had, Dr. Kang, were tremendous for our patients. You've since shifted from your clinical role to a more administrative role. So you've come to the dark side, so to speak. How did your background in emergency medicine prepare you for this executive leadership role now that you're playing?
I don't think it's uncommon to see emergency medicine physicians in leadership, and I don't think it's a coincidence. The reason I say that is the very things that we are taught to do as emergency medicine physicians are the same skills that we utilize in executive leadership. Emergency medicine physicians are taught to focus and finish a task in an environment that can be very busy and sometimes chaotic. We are taught to multitask and triage, which means that we are able to take care of lots of different types of patients with many different types of problems, but we are able to understand who needs care first. And I think most importantly, we're able to do more with less. When you transition those skill sets to executive leadership, you can see that a lot of those same skill sets are used in everyday work. So
It stands to reason, right? Prioritizing in the midst of chaos.
That's
right?
correct.
It's your life in
with possibly limited resources.
With possibly limited resources. And then shifting gears a little bit, emergency rooms were really the front lines of the COVID-19 pandemic, and in terms of priorities and operations changed dramatically for the emergency department staff. How do you restructure kind of the emergency department for this late stage of the pandemic, and how are things different from before the pandemic?
You know, during the height of the pandemic, our true focus was on taking care of patients in a safe way, a large volume of patients, some of them critically ill, while also making sure that our physicians and our staff felt safe in their environment, were able to safely take care of these patients, and were healthy at the same time. Now that we're emerging out of the COVID pandemic, we are trying to re-implement those pre-COVID innovations and those awesome ideas that we had in play before the pandemic. But I think it's really important to remember the incredible impact and effect that COVID had on all of us as people, emotionally, physically, psychologically, and to remember that as we sort of move forward out of that pandemic.
The toll runs beyond the job. You know, you had a twofer, you know, as a healthcare provider, right, in that environment. You also had your home life and the personal struggles that many had gone through as well. So
yeah,
very difficult time, and we thank you very much for all you did there, because you played a big role, Dr. Kang. So what that spells out for me, Dr. Kang, is your emotional intelligence, which I have found to be at the top of the scale in the years that we have worked together, and we're so lucky to have you at Keck Medicine of USC, and in particular at USC Verdugo Hills Hospital.
Thank you, Rod, for the opportunity.